This is Chapter 2 of Food Safety for Food Service Employees. In Chapter 2, we're going to continue looking at foodborne illnesses. We're going to talk about the big 5 foodborne illnesses, and we're going to talk about employee exclusions and restrictions due to illness. According to the Centers for Disease Control, infected food employees are the source of contamination of 1 in 5 foodborne illness outbreaks caused by bacteria or viruses. Most involve fecal-oral pathogens. The fecal-oral route involves an infected food handler that uses the restroom. Their hands become contaminated with fecal material that happens to contain pathogens. They work with food, contaminating it with fecal material and pathogens in the process. A person eats that food along with the fecal material and pathogens and gets sick with a fecal-oral illness. In North Dakota in 2013, there were laboratory-confirmed cases of fecal-oral illnesses. Laboratory confirmation means that the person went to a doctor and the doctor ordered laboratory testing to determine exactly which pathogen was causing illness. The North Dakota Department of Health estimates that for every 1 laboratory confirmed case of a disease, there are at least 10 that are not laboratory confirmed. There were 43 cases of Shiga toxin producing E. coli, which includes E. coli 0157H7. There were 102 cases of Salmonella, 9 cases of Hepatitis A, 18 cases of Shigella, and 24 outbreaks of norovirus, or acute gastrointestinal illness. In just the 7 counties of the 1st District Health Unit in 2013, there were 8 cases of E. coli 0157H7, 7 of Salmonella, 3 of Shigella, 0 cases of Hepatitis A, and 1 outbreak of norovirus, or acute gastrointestinal illness. In 2009, there was a Salmonella Montevideo outbreak that occurred in the 1st District Health Unit. There was a family reunion in Wilton on June 13, 2009. Of the 69 people that attended, 55 got sick and 7 were hospitalized. 17 people were laboratory confirmed to have Salmonella Montevideo. On the same day, there was a wedding in Washburn. Of the 250 people that attended, 36 got sick and 3 were hospitalized. 11 people were laboratory confirmed with a genetically similar strain of Salmonella Montevideo, which means it came from the same source. Ground beef taco meat from the wedding tested positive for the same bacteria. On the 20th of June 2009, there was a wedding in McCluskey. Of the 250 people that attended, 89 got sick and 10 were laboratory confirmed with a genetically similar strain of Salmonella Montevideo. Shredded beef and 2 different pasta salads from the event tested positive for the same bacteria. It was later determined that the source of the sickness was an unlicensed caterer that had made the foods for the events. Employees of the caterer were also laboratory confirmed to have the same illness. Fecal-oral pathogens have 2 traits which make them particularly troublesome. First, they have a low infectious dose. The infectious dose is how many it takes to make you sick. For hepatitis A, it's as few as 10 viral particles, with newer research showing that it may be as few as 1, and it's as few as 1 to 10 viral particles for norovirus, according to a 2008 study. As few as 10 bacterial cells for Shigella sonnei and E. coli are enough to cause illness. When people have these illnesses, they shed these organisms at high levels. There are up to 100 million viral particles per gram of fecal material for somebody with hepatitis A. Keep in mind that there are 29 grams in an ounce. There are up to 1 trillion viral particles per gram of fecal material for norovirus, or up to 30 million viral particles in a single vomiting incident for somebody that has norovirus. This brings us to the big 5 foodborne illness organisms. They are Salmonella typhi, Shigella, enterohemorrhagic or Shiga toxin producing Escherichia coli or E. coli 0157H7, hepatitis A virus, and norovirus. Humans are the only host for Salmonella typhi, and it is spread through the fecal-oral route. Symptoms include sustained fever, headache, malaise, which is a general feeling of unwellness, anorexia, and nonproductive coughing. When diagnosed with Salmonella typhi, patients are treated with antibiotics. For those not treated with antibiotics, about 10% shed the bacteria for up to 3 months. From 2 to 5% may become permanent carriers of the bacteria. The phrase Typhoid Mary is used to describe somebody who spreads an illness. Typhoid Mary was a real individual who was a permanent carrier of Salmonella typhi and was known to have infected at least 33 individuals, 3 of whom later died. There is a 12 to 30% mortality rate in those not treated with antibiotics. There are around 400 cases annually in the United States, which is fairly low, but there are up to 21.5 million cases annually worldwide, with around 600,000 deaths. Antibiotic-resistant strains are becoming prevalent in some areas of the world. Shigella bacteria are primarily found in humans, but they are also found in chimpanzees and monkeys. Symptoms of shigellosis include abdominal pain, diarrhea, typically containing blood, pus, or mucus, fever, nausea, occasional hemolytic uremic syndrome, which involves the kidneys, drastic dehydration, and possibly death. Bacteria is present in the fecal material for up to 4 weeks after the illness stops. The fatality rate for Shigella may be as high as 20% for Shigella dysenteriae. About 300,000 cases per year in the United States, and there are antibiotic-resistant varieties starting to emerge. E. coli 0157H7 comes from cattle, but is easily spread person to person through the fecal-oral route. Symptoms include severe abdominal cramping, abdominal pain, diarrhea, which may be bloody, lack of fever, hemolytic uremic syndrome in about 8% of individuals, and possibly death. There are about 110,000 cases per year in the United States. Hepatitis A virus is spread person to person through the fecal-oral route. In developed countries, such as the United States, most cases are children and are asymptomatic or result in mild illness. The time from exposure to the virus to illness averages 28 to 30 days, but may be as long as 50 days. Symptoms of hepatitis A include nausea and vomiting, diarrhea, abdominal pain, fever, headache, fatigue, and jaundice. Hepatitis A virus can be shed in the feces for 1 to 2 weeks before symptoms appear. In 10 to 15% of cases, prolonged relapsing hepatitis occurs, which lasts for up to 6 months. If it is given within 14 days of exposure, post-exposure prophylaxis is effective at preventing infection. Unfortunately, since symptoms don't occur for 28 to 30 days, most people are not able to get the post-exposure prophylaxis. There is currently a vaccination available which provides immunity for at least 20 years. In developing countries, about 90% of adults are seropositive or show signs of having had hepatitis A virus. This slide shows a person with jaundice. Jaundice is a yellowing of the eyes, skin, and mucous membranes caused when the liver stops functioning correctly and stops breaking down a compound that then travels throughout the body to turn these areas yellow. This is another slide showing an individual with jaundice. Notice how yellow the white of the eye is. The most common route of transmission of norovirus is through the fecal-oral route with contaminated food, but airborne transmission has also been documented. Outbreaks have occurred in food service establishments where patrons vomited in the dining area and in establishments where employees vomited in food prep areas. Norovirus is highly infectious and is the leading cause of foodborne illness in the United States, according to the Centers for Disease Control. Cruise ships, hotels, and schools, one infected individual in these locations can infect 50% of the people around them. Symptoms occur 12 to 48 hours after exposure and include acute onset projectile vomiting, watery diarrhea, abdominal cramping and nausea, and often all at the same time. As many as 30% of infected individuals show no symptoms, but can still transmit the illness to others. People ill with norovirus may shed the virus for up to 2 weeks after their symptoms stop, and there is no long-term immunity and no cure. If you go to a doctor and are diagnosed with any of the big 5 foodborne illness organisms, Salmonella typhi, Shigella, E. coli 0157H7, hepatitis A virus, or norovirus, then you must be excluded from working in a food establishment. You must inform your manager or supervisor that you've been diagnosed with one of these illnesses, and your manager or supervisor must call the 1st District Health Unit and report to us that they have an employee who has been diagnosed with those illnesses. The person is not able to return to work until they meet a certain set of criteria specified in the food code. Once they meet these criteria, they can get a note from their doctor saying they have met them. The note can be presented to the 1st District Health Unit, and the person can be cleared to return to work. In addition, if you have any of the following symptoms: diarrhea, vomiting, jaundice, or a sore throat accompanied by fever, then you must also be excluded from working in a food establishment. You're going to have to tell your manager or supervisor that you have those symptoms, and they're going to have to remove you from the schedule. They do not have to report that they have an employee with these symptoms to the 1st District Health Unit unless the symptom is jaundice, because jaundice may indicate hepatitis A. 24 hours after the symptoms stop, the employee can return to work. If you need to tell a believable lie, tell them you had diarrhea. No one ever has follow-up questions about diarrhea. The reason for this is most people don't like to talk about diarrhea. But in a food establishment, it's important to have an employee health policy. Make sure your employees know that they cannot work when they have diarrhea and will have to notify management. In cases of individuals who have irritable bowel syndrome or Crohn's disease, which are not transmissible through food, they can get a note from their doctor specifying that they have that illness, that they have diarrhea as a symptom, but to the best of the doctor's knowledge, they do not have a foodborne illness. With this note, they will be able to work in a food establishment. With vomiting, it is also important to have an employee health policy so that employees know that if they are vomiting, they are not supposed to be working in the food establishment. One possible symptom of excess drinking is vomiting in the form of a hangover, or bottle flu as some people call it. If you have employees that may have a hangover and are vomiting, they would still have to be excluded from the food establishment because there is no easy way to determine if the vomiting is from norovirus or from drinking too much. Occasionally people will ask about morning sickness during pregnancy, which is a common symptom. If you have an individual who is pregnant and has been experiencing morning sickness and vomits, they can go to their doctor and get a note specifying that they are pregnant, that they've been vomiting, but to the best of the doctor's knowledge, they do not have a foodborne illness. With this note, they are able to return to work. A common concern with food establishments is that they do not have enough employees to cover all their shifts. If employees call in sick with diarrhea, vomiting, jaundice, or a sore throat accompanied by fever and can't work their shifts, there may not be enough employees to cover that shift. One thing you have to keep in mind is by knowingly having these people work in a food establishment with these symptoms, they may be capable of spreading a foodborne illness to members of the public. If you knowingly have an employee with one of the big 5 work while they are sick, or if you have an employee work when they have diarrhea, vomiting, jaundice, or sore throat accompanied by fever, it may result in the permanent license revocation for your food establishment. Finally, if a food employee has a lesion containing pus or an infected wound that is open or draining on their hand, then they will need to have an impermeable cover on the wound and wear a single-use glove at all times when working with food. If any food employee has a bandage on their hand at any time, they should wear a single-use glove over the bandage while they are working with food. If the wound or lesion is on the arm, then you will need to have an impermeable cover over the wound while working with food. This is to prevent Staphylococcus bacteria from contaminating the food, as Staphylococcus can cause a foodborne illness. This is the end of Chapter 2 of the course.